Question. Essential major blood culture criteria for infective endocarditis. 1. Single positive culture of HASEC. 2. Single positive culture of Coxiella. 3. Single positive culture of MRSA. 4. Both 1 and 2. So, what do you think should be the answer to the question? The correct answer is option 2.
The diagnosis is based on the modified Duke's criteria. This can be simply remembered by using a mnemonic B fiber, BEFIBER. The major criteria are the blood cultures and the echocardiographic evidence. The blood cultures are nothing but two positive blood cultures of typical organisms drawn at least 12 hours apart. Or all of three or 3 out of 4 blood cultures should be positive with first and last separated by 1 hour. Or a single positive blood culture of Coxiella burnetii or a serology IgG positivity of Coxiella burnetii will also satisfy the criteria of blood culture for this patient. Now number 2, the echocardiography or CT angiography or PET-CT, basically a radiographic evidence of vegetation or abscess or new dehiscence of the prosthetic valve and a new valvular regurgitation. These two come under the major criteria. Then we have the minor criteria. Minor criteria can be remembered by using a mnemonic fiber. F for fever, a temperature of more than 38 degrees centigrade or 100.4 degrees Fahrenheit. Immunological phenomenon, which we already understood, they are glomerulonephritis, Roth spots, oscular nodes, presence of rheumatoid factor. B for blood culture positivity or serology positivity not meeting the major criterion. Number 4 are the embolic phenomenon, which are nothing but the Janeway lesions, conjunctival hemorrhages, major arterial emboli resulting in acute coronary syndrome, stroke, or intracranial hemorrhage. And lastly, R for risk factor. But how do we come to the diagnosis based on the major and minor criteria? Firstly, 1 major or 2 minor criteria are fit for nothing, they are not useful for diagnosis. So, you can call it as possible endocarditis if the patient has 1 major and 1 minor criteria or 3 minor criteria. You can call it as definitive endocarditis when we have 1 major plus 3 minor criteria or 5 minor criteria or 2 major criteria. Both possible endocarditis and definitive endocarditis should be treated as having infective endocarditis. The treatment would be the same. The sensitivity of Duke's criteria in the diagnosis of infective endocarditis is 80% and specificity is 95 to 100%.
Okay, now try answering this question. Put the answer in the comments and subscribe to our channel.